The link between climate change and the Zika virus outbreak. It originated and how it spread. The Zika virus disease is a virus that is transmitted either through a species of mosquito named the Aedes mosquito or through sexual activity. The virus has originated in Africa, but now due to one of the many environmental factors including climate change, the virus is circulating around more than 60 countries. In a few states in America, including Florida, where the weather is warm and moist, there has been most recent activity of this virus. In this picture, it shows the places around the world where the virus has been previously active and where it is active now. There has been recent activity in the southern states in America, but there has also been reported cases all throughout America. In the dark purple, it shows where the virus has been most active recently. In the light purple, it shows where there has been recorded cases, and in the pink, it shows the areas where the virus had started off. Up until about 2 to 3 years ago, the Zika virus was considered to be rare. To date, there has been about 4,000 recorded cases in America, and on top of that, there has been 1,500 recorded cases of pregnant women being infected. Who does the virus affect? This virus can infect anyone. The normal symptoms include a fever, rash, joint and muscle pain, and headaches. They can last from 1 day up until about a week. The symptoms aren't horrible. They are pretty similar to regular infections. The worst part of it is for pregnant women. The infection doesn't affect the woman as much, but the infection has the potential to transfer to the fetus. If the fetus were to get infected, it has the possibility that it might develop birth defects. One of the main birth defects that is the most common is microcephaly. This is a condition where a baby's head is much smaller than expected. This is due to the brain to have stopped growing and developing before birth, which causes the head to stop growing. Alongside the visual aspect to this condition, the baby might also have eyes and ear problems with talking, walking, and a decrease in ability to learn. Some pictures to show what this condition can do to babies and why pregnant women should stay away from places that have had recent cases reported of the virus being there. The Zika virus is already a virus that, for one, does not have a cure or a shot to prevent it. It is a very complicated, and when environmental factors come into place, it makes the whole situation even more complicated. Over the past few years, mosquitoes have been making their way to places they've never been before. Researchers have said that the increase in temperature has caused the mosquitoes that are spreading the Zika virus to grow and reduce faster. This leads to an increase in their metabolism, and it makes them bite more, which causes the spread of the virus. The higher the temperature, it will increase their habitat range and will also cause them to be more aggressive and have shorter lifespans. Quoted from an article titled, "The Link Between Zika and Climate Change," says the warming of 2 to 3 degrees would and can put up to 7% more people globally at risk for not only the Zika virus, but any mosquito-borne virus. What we can really do to protect ourselves from this virus is to wear bug repellent and to take precautions when traveling to places where the virus is present. And for pregnant women or if you're planning on getting pregnant, then to stay away from these areas. Cold places are starting to get warmer all the time. The virus will continue spreading into warmer areas. The virus is making its way north, and in no time I'm sure there'll be multiple cases recorded in Canada.